Hey guys, for my drug, I chose Xcopri. My PowerPoint is not allowing me to add audio, so I'm recording it with my phone and hopefully it goes well. So the FDA granted the approval of Xcopri to SK Life Science Incorporated in November of 2019. Soon after, on March 10th of 2020, the DEA designated Xcopri as a Schedule 5 drug. The prototype for this drug is phenobarbital. This drug falls under the classifications of anti-epileptic and anticonvulsant. The mechanism of action for Xcopri is unknown, but it has been demonstrated to reduce repetitive neuronal firing by inhibiting voltage-gated sodium currents. It is also a positive allosteric modulator of the Y-aminobutyric acid ion channels. Xcopri is indicated for patients who suffer from partial onset seizures. A seizure is usually a short episode of abnormal electrical activity in the brain. Seizures occur when clusters of nerve cells or neurons in the brain undergo uncontrolled activation. A partial seizure begins in a limited area of the brain. Xcopri is given orally as a tablet. You should not crush or chew the pill, but you may swallow it with water. You can take it at any time of the day, with or without food. This medication must be titrated until the desired dose of 200 to 400 milligrams per day is reached. If discontinued, you must discontinue gradually over at least a 2-week time frame. Do not stop taking this medication abruptly. The most common adverse effects reported are sleepiness, dizziness, fatigue, diplopia, headache, suicidal thoughts, and an increase in serum potassium levels. A few of the less common adverse effects include nausea, balance disorder, constipation, and gait disturbances. Caution: you should not take Xcopri if you have hypersensitivity to cenobamate or if you have familial short QT syndrome, or SQTS. Many drug interactions were reported included phenytoin, phenobarbital, clobazam, rufinamide, CNS depressants, lamotrigine, carbamazepine, and oral contraceptives. You should also avoid the use of alcohol consumption with taking this medication. At least 88% of Xcopri is absorbed following oral administration, with its median Tmax ranging from 1 to 4 hours. The apparent volume of distribution is approximately 40 to 50 liters. Plasma protein binding is 60%, primarily to human albumin, and independent of concentration in vitro. The apparent terminal half-life of cenobamate is 50 to 60 hours, and apparent oral clearance is approximately 0.45 to 0.63 liters per hour over a dose range from 100 milligrams a day to 400 milligrams a day. The study showed that the following administration of radio-labeled cenobamate, a mean of 87.8% of the total dose was recovered in urine and 5.2% in feces. Unchanged cenobamate accounted for 6.8% of the dose, which was mainly excreted in the urine. More than 50% of the radioactivity was excreted within 72 hours of dosing. Since this drug is excreted through the kidneys with waste, it should go without saying that you should use caution when administering to patients with renal failure, as well as patients with hepatic impairments. Xcopri comes as follows: 12.5 milligrams, 25 milligrams, 50 milligrams, 100 milligrams, 150 milligrams, and 200 milligram tablets. The size and shape varies on each pill and strength. Throughout the clinical trials, there is limited experience with overdose, therefore no specific overdose antidote has been found. If you suspect that you are experiencing an overdose, you should call poison control or 911 if emergent. A normal overdose protocol should be put in place. When it comes to the study, there were 2 randomized, double-blind, placebo-controlled studies involving Xcopri, totaling 665 participants. Patients enrolled in the studies had partial onset seizures with or without secondary generalization and were not adequately controlled with 1 to 3 concomitant AEDs. During an 8-week baseline period, patients were required to have at least 3 or 4 partial onset seizures per 28 days. In these studies, patients had a mean duration of epilepsy approximately 24 years and median baseline seizure frequency of 8.5 seizures per 28 days. 51% of these people were men, and 49% of them were women. Of those, 74% were white, 21% were Asian, 2% were black, and 3% other or unknown ethnicities. Based off of these participants, both genders had similar results. Given that most of the participants were white, it is hard to say if race had a play in the results. 98 of the participants were under the age of 65, so there are no results for older patients. There is still no pregnancy class determined for the drug. Both trials were double-blind, meaning that neither the participant or the provider knew who was receiving the real drug or who was receiving the placebo. A baseline of 8 weeks without Xcopri was compared every 28 days to 8 weeks with Xcopri or placebo. This is how the results were obtained and prepared. Xcopri is expected to be available in the U.S. in the second quarter of 2020.